Good evening, everybody. This is In Your Corner with CORA, and I'm Dr. Rick Lehman from St. Louis, Missouri. We have a star-studded list tonight of members that are going to talk about adolescent baseball injuries, which is actually very, very common. And I think in this coronavirus environment, kids are starting to play, coming out of quarantine, etc., sheltering in place. And we do expect to see a significant number of overuse injuries. I think it's been hard to train. The regular training regimen has not been what we've seen in the past. And so based on that, we do believe we're going to see a fair number of overuse injuries. So I'm going to have everybody introduce themselves, starting with Tyler.
Hey guys, I'm Tyler Kelly, Senior Clinic Manager with CORA up in Virginia. My experiences with baseball, I played through high school. Mostly was a catcher, and then I worked with a college baseball team as an athletic trainer.
Dalton.
Hey guys, my name is Dalton Schumer. I'm a physical therapist in the St. Louis region at Arnold, Missouri. I've been playing baseball my whole life. Played collegiate ball for Maryville University. Was a middle infielder originally, and then moved to third base as well. So.
We have a special guest tonight, Zack Kelly. Give us a shout out.
Hey guys, my name is Zack Kelly. I am currently a professional baseball player. I played my collegiate baseball at Newberry College in South Carolina. I spent 1 year with the Oakland Athletics and 2 for the Los Angeles Angels.
And Jim, fired up.
Senior James Silvestri, Senior Clinic Manager in East Tennessee. Baseball background. I owned a PT facility and a baseball academy in Louisiana for about 10 years. Saw a variety of patients, baseball players in that arena. Always had a passion for it. Played baseball up until my late 30s and some men's league stuff around my area. So actually got into it because of a shoulder injury as far as physical therapy, and wanted to know more about how we can help baseball players. So that's how my passion started.
Jim, you can't be more than 30. That can't be. So let's jump into it. I think one of the things we see very, very frequently are overuse injuries in these kids. And these kids can be anywhere from 8 to 16, 17 years old. So I think the first thing I'd like to ask, and we'll start off with Tyler, is give me what you think your common age would be for both Little Leaguer's elbow, Little Leaguer's shoulder, and maybe Seaver's disease, where we're seeing overuse in some of these younger kids.
Most common age range you're going to find for the Little League elbow is probably about 8 to 15 years old. With the elbow, it's kind of the same age range, maybe a little bit older, 11 to 16. And it generally is an overuse injury with these guys. But you're not looking at someone as young as 5 years old. And once we get kind of into high school ball, you don't see this Little League elbow, Little League shoulder conditions as frequently.
Let's just get right to it, Tyler. So if someone comes in and they have elbow pain, they're 16 years old or 17 years old, you get an x-ray, growth plates are closed. What are you thinking about? Medial elbow pain, what are you looking for?
Well, one of the first things I want to do is talk with the parent of the kid, and then also with some of the coaches to figure out maybe where this is coming from. Is this coming from simply overthrowing? Are they trying to throw too high velocity too early? Are they not following proper protocols? Are they throwing off-speed pitches, curveballs, sliders at too young of an age? I'm going to start there and then try and work my way back from that to figure out, okay, if I figure out the cause, maybe I can work with the treatments a little bit better and can give me a better design of where I'm going to be headed.
Thank you. Dalton, so someone comes into the clinic, they basically have Little Leaguer shoulder, widening of the growth plates, shoulder pain, having trouble throwing. What are you going to tell the athlete and the parent? How long do you think it's going to take in terms of resolution, and how does physical therapy work and rehab? And is it just rest? Where does rehab come in for these athletes?
Well, I think in today's day and age, I think with the modern baseball atmosphere we've created with all this competitiveness and the recruiting and all that, I think it's important to be clear on the front end and say, hey, we need to take a little break. We need to take care of this pain and the injury that's at hand, and look at their future. So getting that across is first and foremost is most important. But beyond that, I think we start to look at the strength of their actual shoulder, maybe the shoulder girdle muscles, and then also we can break down how they're throwing the ball. So once they get away from the actual throwing, the pitching, the resting, we get back to assessing their mechanics and progressing them back. But ultimately, just looking at several weeks of rest, of good quality rest without throwing.
And do you think video has any place, Dalton, in this? I mean, do you ever, I know a lot of times I'll have the coaches film either the pitching mechanics or the throwing mechanics of a catcher or an infielder. Do you think video or any type of digital analysis has any place in assessing throwing mechanics for these kids?
Absolutely. And I know I think some people think that an iPhone isn't good enough. Well, I think in some cases that's very well good enough. You can get an idea of what the kid's doing. For instance, there's even research to suggest just early opening of the trunk and the glove side can kind of put extra stress on the elbow. And there's a lot of things you can just pick up with just simply using an iPhone. So absolutely, it's definitely beneficial as a physical therapist to kind of see that, and we can kind of cater that to each individual.
Thank you. Jim, so here's a tough question. Give me the predisposing factors. Where are the issues? What are the predisposing factors for why a 12-year-old little leaguer comes in and has shoulder pain or has medial elbow pain? And why does this happen? What leads up to this?
Well, I think we can all agree that these types of injuries are overuse injuries. So a lot of time it's just too many repetitions, too much throwing, too much time on the field, too much practice, and a lack of preparation to do those things. So a lot of these athletes don't have the neuromuscular control. They aren't developed athletically very well. They're trying to work on a skeletally immature frame, and they're putting too much stress on the growth plates too soon. So a lot of the research is just showing that, if you are practicing more hours in a week or playing more hours in a week than your age, then you have a 70% increase in risk of an injury. I mean, those are pretty telling numbers in my mind. So I think a lot of it is just preparation or the lack of preparation that can create these issues, as well as throwing too much. It's really an overusage. Number of innings pitched in a year, number of actual pitches thrown.
I think that's right. A lot of times you talk to these parents and they've got pitching lessons and they're playing on 2 teams and they have a traveling team. And the next thing you know, if you're counting innings or you're counting pitches, you're like, this is crazy. Or a coach will pull a kid in for an inning here and an inning there, as well as, their normal rotation. So I agree with that. Zack, you came up through the ranks. What were the parameters of your throwing as 10-year-old, a 15-year-old, 18-year-old? How much did you throw? Were there pitch counts? Were people watching your mechanics? Tell us what happened kind of growing up.
Well, I honestly didn't start pitching consistently on a constant basis until really high school. I always, I'd pitch a third, fourth game of a weekend if I needed to. But for the most part, I usually stayed in the outfield. But what you see a lot of times nowadays, kids get so caught up in showcase baseball, traveling to tournaments every weekend, going multiple states away. And while a lot of the injuries can come from overuse, a lot of the kids' injuries just come from they're not preparing their arm and their body for these tournaments. You get to a certain stage where, for instance, my junior year of high school, I played on a showcase team out of North Carolina, being in Virginia, and so we didn't practice during the weeks. We just had tournaments. We went and played on the weekends, and so a lot of these kids that are doing that, they don't do anything during the week, especially when it's summer and they're off doing whatever other activities it may be, and so they don't throw during the week, and then all of a sudden on Saturday, they're asked to go throw 80, 90 pitches, and you can't do that. You can't do that on the weekend if you're not preparing yourself for that during the week. And a lot of athletes, nowadays are, trying to be so sport specific and trying to get into one sport only, where, that's great and all, but you still have to be able to shut down throwing if that's what you're going to do. So I think another really good way to kind of get around that is to be a multi-sport athlete. That way you're still training your body, you're still training your muscles, but you're not sitting here, tearing up your shoulder, tearing up your elbow 12 months a year.
Excellent. So the next question I'm going to throw out there, and I'm going to ask everybody to answer this question, and really this is geared towards the coaches and geared towards the parents. And the question, which is common, is what are you going to tell a coach? How does a coach avoid these overuse injuries, elbow, shoulder, possibly heel? And what are you going to tell the parents to look for? And how do they avoid these problems in their kids? So Tyler, we'll start with you, and we're going to go around the horn here. I want everyone to answer that question, give me their thoughts on advice to give the parents, advice to give the coaches.
I would give kind of the same advice to the coach and the parents about they have to know when their kid's already hurting. Sometimes they just may not be able to catch it before it happens. But they have to know the signs of, and they have to know their kids, of when they're hurting, because kids are going to lie to us. They want to play. They don't want to stop playing because, first off, they just want to play. They enjoy playing. And then they want to keep competing to get to the next level. So they're not going to tell us the truth. We can't necessarily be mad at the kids because we probably did it when we were their age too. But we need to let the coaches know and the parents know that they need to be more aware of what are the telltale signs of their specific kids. What are their signs of pain? Do they kind of shut down? Do they become a little bit more quiet? Do they seem to withdraw from the team a little bit? Knowing when their kids are hurting is the easiest way to prevent a little injury or just something that may need a week's rest. It could prevent it from being something that needs 6 weeks rest or 3 months rest.
Dalton, all in your court, buddy.
I think my point kind of segues off that perfectly. And my point would be that, and this is probably the most challenging, honestly, is to get across to these coaches that the reason these guys are playing, 12U, 13U, 14U, is to develop ultimately. Nobody's going to care if you won that tournament out in wherever at 12 years old or 13. Those are good times and that's great. But ultimately, we've got to have the future in mind and keep these kids healthy. So listening to their bodies and looking for signs of fatigue. And I think the easiest ones as a parent or coach is, is their velocity dipping down? Are they losing their command? And like Tyler said, they're not always going to tell you. But there are little things that you can kind of pick up if you kind of know the kids well enough. So,
Jim?
Wow, not much to say after all that. I mean, those guys, Tyler, Dalton, and Zack, man, you kind of put it all together for sure. I mean, a lot of it is communication. The coaches and the parents and the players have to communicate, and the players can't be afraid to say that they're having an issue to take care of it early rather than become a big problem later. So, I mean, I think this whole thing comes down to have communication between multiple parties. It's not just your coach. It's your coach, your parent, your player. It's a strength coach. It's a physical therapist. It's all them together that can create a program that develops an athletic program of development for these players that will last them through high school to college, to even beyond that if possible. But there has to be the communication and there has to be an integration. A lot of times the parents know more than anybody about what exactly their kid is doing, but you got to have that communication across the board.
No, I think that's right. And I think the parents have to talk to their kids. The kids are upstairs playing Fortnite and they're doing their own thing. And there isn't that communication between the parents and the athlete. And I think, you have to talk to your kids. And I also think the parents have to talk to the coaches. The last thing the coach wants to do is get a phone call from the parent. But on the other hand, I think you're right. I think you're all right. That line of communication is very important. Zack, any thoughts? Give us some closing thoughts here.
Yeah, I agree with what everybody said. I like what Jim said, talking about the communication, because I think as a whole in sports, we need to start getting away from, the negative reaction we get from a lot of coaches and parents when kids say they're hurt. I feel like that's a reason why a lot of kids, they don't bring up when they're hurt. I think so. I think the communication is the biggest part. Like Tyler said, the lack of communication can be the difference between, whether missing a tournament or missing your whole season. And so I think there definitely needs to be a priority on the communication, and that's got to come down from the coaches and the parents as well, because you can't have a 12-year-old kid being the center of communication on your team. So I definitely think the communication is really where it starts.
I agree with that. And I think the other point that was a very good point is, so what, you're a grade 12-year-old. If you're trying to play college ball, you're trying to play at a high level of high school ball, or possibly where you are, Zach, being the best 12-year-old on the field, it doesn't do you any good. And maybe it's better to play a position if you're very, very good. I had a kid who ended up playing for the Angels whose dad wouldn't let him pitch till he was 17, and he could throw 100, but he didn't want a bunch of college coaches or high school coaches basically ruining his career before he had a chance to showcase what he could do. And I think a lot of times being the best 12-year-old or 14-year-old is a detriment to where you're going to end up. So I think that those are points well taken.
Yeah, I couldn't remember a single tournament that I won when I was 13 and 14 years old.
Exactly. And if you did, so what? You got a medal and sit in some drawer somewhere, and who cares? But there's no point in these kids' careers ending in my office, that's for sure. And I think parents have to look at the big picture and understand that, really, when do you have to be good? You have to be good when you're 16 or 17, and then after that. And before that, you get a lot of trophies that you basically give away to goodwill, so big deal. I want to thank everybody. This was really good. I think the content was great, and I really appreciate everybody's input. So everybody have a good night, and thanks again.